Blue Cross Blue Shield of North Dakota wants to welcome providers to the Getting Started Insurance Basics Education on Demand. This video is a brief overview of things to keep in mind when you see Blue Cross Blue Shield of North Dakota members. This education on demand pertains to the Blue Cross Blue Shield of North Dakota commercial line of business. Disclaimer. This information release is the property of Blue Cross Blue Shield of North Dakota. The information is provided as is without any expressed or implied warranty. While all information in this document is believed to be correct at the time of writing, this document is for educational purposes only and does not purport to provide legal advice. All models, methodologies, and guidelines are undergoing continuous improvement and modification by Blue Cross Blue Shield of North Dakota. The most current edition of the information contained in this release can be found on the Blue Cross Blue Shield of North Dakota website, www.bcbsnd.com/providers. All rights reserved. Where to begin? Getting to know your resources. Blue Cross Blue Shield of North Dakota offers an array of plans to provide our members with the best option for their needs. This video is going to focus on insurance basics for our commercial line of business. And the commercial line of business supports members who may have a plan through an employer group, individual coverage purchased directly through Blue Cross Blue Shield of North Dakota, or coverage purchased through the federally facilitated marketplace. You may see or hear lines of business referenced throughout Blue Cross Blue Shield of North Dakota educational materials. This reference is used to differentiate Blue Cross Blue Shield of North Dakota product associations, which include commercial, as mentioned, Blue Cross Blue Shield of North Dakota Medicaid expansion, and Next Blue of North Dakota Medicare Advantage plans. Let's begin by going over our provider resources. As a provider, many resources are available to you. We want to mention a few important resources to help you in your journey. This includes our provider website, the Provider Service Contact Center, and the Availity Essentials Provider Portal. Let's start with the www.bcbsnd.com website. This is a main resource you may find yourself using. Navigate the drop-downs located at the top of the page to find resources including, but not limited to, medical and reimbursement policies, pre-authorization information, eligibility and claims, provider forms, news and resources, which contain the provider manual, credentialing, and Availity Essentials tips page. It is highly recommended to sign up for healthcare news to receive up-to-date information pertaining to these items listed here on this slide. To sign up, go to the News and Resources section of our Blue Cross Blue Shield of North Dakota website. For help with general benefits, billing questions, claim status, and payment details, contact the Provider Service Center at 800-368-2312. For technical support issues relating to the Availity Essentials Provider Portal, contact the Availity Essentials Contact Center directly at 800-282-4548 or utilize the Availity.com website. Since we will refer to Availity Essentials throughout this presentation, I wanted to talk about it first. If you haven't signed up for an Availity Essentials account already, we encourage you to add this to the top of your to-do list. Availity Essentials offers secure online access to multiple payers and requires a user ID and password. It is compliant with all HIPAA regulations at no cost to providers. Availity Essentials offers many administrative functionalities such as verifying eligibility and benefits, submitting claims, and more. If you are registered for an Availity Essentials account and cannot access some of these functionality options, reach out to your Availity Essentials designated administrator to check your access. Availity Essentials also offers ample resources on how to use their portal for enrolled providers. Once logged into the portal, under the Help and Training dropdown, you will see Find Help, Payer Help, and the Get Trained options. These will allow you to view different educational materials. Problems registering or logging on? Contact Availity directly at 800-282-4548. We have also created a reference guide in which you can see linked here, located on www.bcbsnd.com. This will assist providers in getting started, as well as direction on how to find additional materials for using the Availity Essentials portal. Now that we have discussed resources, let's focus on additional details that will apply to you as a provider. Blue Cross Blue Shield of North Dakota plan networks can vary. Some may have an in and out of network setup, others may have a multi-tier network. Why does participating with a network matter? Participating with a specified network allows your patient, our member, to receive the highest level of benefits possible as outlined in their plan. This can help reduce the additional financial cost, as some members may have higher cost shares that apply when going outside of their designated network. If a provider is not participating with Blue Cross Blue Shield of North Dakota at all, this will greatly impact members' financial liability, and the member may choose to go elsewhere for their services. If you plan to see a Blue Cross Blue Shield of North Dakota member, you may want to think about credentialing to participate with Blue Cross Blue Shield of North Dakota. Participating providers receive payments and payment details directly from Blue Cross Blue Shield of North Dakota, and the provider will then be visible within the provider directory search accessed by members. If you are wondering what the process is to credential a clinic or facility, check out our credentialing policy, which has more information on the process and requirements to become a participating provider. This policy, along with applications, can be found on the website listed here. Now let's talk about the insurance ID card. When a patient comes into your office with their ID card, look at the details presented on the card. This will give vital information to assist you with next steps. The ID card will indicate if a member has Blue Cross Blue Shield of North Dakota or another insurance carrier. It also has the member's unique member identifier, also known as the UMI, which will be beneficial when trying to verify eligibility and benefits. To find more information about the look and information on the Blue Cross Blue Shield of North Dakota ID cards, utilize the ID card document linked here. Verifying eligibility and benefits. Once it has been determined that Blue Cross Blue Shield of North Dakota is the member's insurance plan carrier, you can contact the provider service phone number on the back of the ID card to verify eligibility and benefits. Or you have the option to verify eligibility and benefits electronically through the Availity Essentials portal. Please note, Availity Essentials will not be able to provide all detailed benefit information. For benefit information that does not apply within the portal, please contact the Provider Service Center. As referenced in the resources earlier, medical and reimbursement policies, along with pre-certification requirements, can be found on the Blue Cross Blue Shield of North Dakota website under the Pre-Certification and Policies tab. The search box function on this page allows you to narrow your search by keyword or CPT code. Applicable policies matching the criteria entered will populate, and if no policies apply, it will be indicated below the search box. Pre-certification submission should be completed through the Availity Provider portal. Services not pre-certified will reject as provider liable. Appeal rights are available if a provider disagrees with the determination. Blue Cross Blue Shield of North Dakota has developed medical and reimbursement policies that serve as one of the sets of guidelines for coverage decisions. Benefit plans vary in coverage, and some Blue Cross Blue Shield of North Dakota plans may not provide coverage for certain services discussed in medical or reimbursement policies. Coverage decisions are subject to the terms and conditions of the applicable benefit plan, including specific exclusions and limitations in effect at the time of service, and are also subject to the applicable state and federal laws. We try our best to provide a 30-day notification of changes to our providers through healthcare news articles or letters. Additional medical or reimbursement policies may be developed, and some may be withdrawn from use. Blue Cross Blue Shield of North Dakota reserves the right to review and update its medical policies periodically without notice. Blue Cross Blue Shield of North Dakota makes all coverage determinations based on current medical policy or policies in effect at that time. Medical technology is constantly evolving, and these medical policies are subject to change without notice. Policies will also identify whether they are applicable for Medicaid expansion, commercial, or a combination of the two. Medical and reimbursement policies are not an explanation of benefits, nor do they constitute plan authorization, certify coverage availability, or constitute a contract. Claim submission. Claims should be submitted electronically from the Availity Essentials provider portal or contracted provider clearinghouse within the timely filing period as outlined on the member's benefit plan. Most Blue Cross Blue Shield of North Dakota plans utilize a 12-month time period, which begins from the original date of service. If electronic claim submission is not an option, paper claims must be submitted according to the guidelines outlined in the commercial provider manual found on our website. When utilizing the Availity Essentials portal for claim submissions, ensure you are enrolled with the payer ID 55891 BCBSND. Once you select the Blue Cross Blue Shield of North Dakota payer and submit your claim, the claim will go through a series of edits to verify all information entered is valid. If it is, the claim will be sent to Blue Cross Blue Shield of North Dakota for further verification and processing. If the information is invalid, a front-end reject may apply. This means the claim has not entered the Blue Cross Blue Shield of North Dakota system. If you submit the claim to the incorrect payer, it may show as though it was submitted successfully, but return a reject upon further validation. Front-end rejections will show in the Availity Essentials Provider Portal. Once a claim is finalized, a remittance and electronic funds transfer details will be published within the Availity portal as long as you have signed up and have access to view that information. Provider Directory Validation Process. The directory validation process is important as it ensures the Blue Cross Blue Shield of North Dakota directory reflects accurate information. By ensuring information is accurate and updated, you help patients in the search for their health care. Each participating provider group or organization should continue updating Blue Cross Blue Shield of North Dakota of their changes as they occur and respond to our semi-annual survey. To review your provider directory information, confirm its accuracy, or request changes, please use our Availity Essentials Provider Portal. Even if you didn't have changes throughout the year, you still need to validate through Availity Essentials. If a provider fails to make an effort to update Blue Cross Blue Shield of North Dakota as changes occur, they may be removed from our provider directory. If you're having issues with Availity registration or login, you again can contact Availity directly at 1-800-282-4548 or go to www.availity.com. If you're having issues with the directory validation process, you can contact our Blue Cross Blue Shield of North Dakota provider credentialing team at 1-800-756-2749 or email them at prov.net@bcbsnd.com. You can also review the dedicated instructions for this process on the BCBSND webpage under News and Resources, then Directory Validation Process. This education on demand was to learn the basics for getting started with our commercial line of business. You may also find the additional education on demands posted for Medicaid expansion and NextBlue of North Dakota helpful as well. If you have questions regarding NextBlue or Blue Cross Blue Shield of North Dakota Medicaid expansion, you can utilize these direct links for their sites. Thank you for taking the time to listen to this education on demand today. If you have any questions regarding the content of this education on demand, please contact the Provider Service Center.